Good morning, everyone. It's such a pleasure to be here today. I want to thank you so much for your attention, and thank you to the EDS Society for this invitation. I'm really thrilled to be here. I want to start by acknowledging my Mayo Clinic, Florida EDS clinic colleagues, Dr. Dacre Knight, who spoke yesterday, Dr. Shilpa Gajarawala, who will be speaking later this afternoon, and my research colleagues, Dr. Caitlin Bruno and Delisa Fairweather, who provided me with some data to present to you today, so thank you all. I've been practicing physical therapy for 34 years, and 32 years of those as a pelvic physical therapist. I work primarily with females, but I also work with men, and my entire career have been working to help males and females improve their sexual function. I'm highly specialized in my clinical practice, but you should know that all physiotherapists are trained to evaluate movement and function. And so I'll be smiling during this entire presentation for several reasons. Firstly, I'm so happy to be here, and I love working with patients with EDS and HSD to help them improve their function. I also am so happy to be at a conference where I get to talk about sex. Who gets to do that internationally? And finally, this is my first time speaking to an audience that includes both patients and professionals, and I think it's just wonderful. It's been so great to hear everybody's perspective today. And yesterday. So the title of my presentation is Sexual Health Concerns and Solutions for Males Assigned Male at Birth with EDS and HSD. But this presentation is also directed at males and, to partners of males and males assigned male at birth, and to females and to the partners of people with EDS and HSD. This will be a brief overview and not specific to any individual person or patient. And what I hope to accomplish is that we'll identify and validate sexual health concerns reported by males and individuals identifying as males at birth with EDS and HSD. And I hope to explore strategies and solutions to address concerns regarding sexual health. In the past decade, we've learned that relationships affect health and health affects relationships. It goes both ways. In a German study of more than 2,300 males aged 18 to 75 years in 2020, researchers found that the likelihood of being sexually active decreased from 79% if they identified as very good health to 59% if they identified as having fair health to down to only 30% if they identified as having poor health. This was not specific to EDS or HSD. And we know from research that sex is physically demanding. A 2012 study of the physical demands of sex found that sex is indeed physically demanding. The study of 21 healthy non-EDS HSD heterosexual couples, the young males averaging 23 years of age, expended about 100 calories or kilocalories during a sexual encounter. Sexual physical activity can also strengthen muscles, reduce blood pressure, and improve heart health. So you can count your sexual activity as physical activity. The demands of sex do vary quite a bit, and it depends on a number of factors, including your health status, the position of intercourse, the duration of the activity, the phase of intercourse, and gender and sex differences. The average duration of intercourse was found to be 32 minutes in healthy males, but it decreased to 19 minutes in males with cardiovascular disease. This study also looked at different positional demands and found certain positions required more back flexion or spine bending forward of the spine. These were the missionary and sideline positions. And all positions required at least 40 degrees of hip external rotation in males. And I found this picture on Microsoft Stock Images to show you what that means. Hip external rotation is when you spread the legs open. When we're under physical or psychological stress, and we've been talking about this a lot over the last day or so, our bodies release a hormone called cortisol. Researchers in a 2019 study examined the cortisol levels of stressed adults during nonverbal acts of intimacy, which Mackenzie Aberson just did a wonderful job of reviewing. So if you're having a bad day, while it may seem counterintuitive, couples who experienced snuggling, cuddling, hand-holding showed faster recovery from stress as measured by a change in cortisol levels. So this might actually be a strategy to help you recover from stress, is to have more intimacy. So the EDS Society surveyed their male members and found that they have both physical and psychosocial concerns relating to intimacy and sex. And that survey is what informed the agenda for this first couple days of this conference. So physical concerns include holding positions during intercourse. Of course, people with EDS are concerned about joint pain and instability, and in particular, during sex, they're concerned about hip concerns, hip pain, hip subluxations. They were concerned about being able to hug, to hold contact, and to share their bed. They were concerned about these positions causing acute pain. So hopefully we can address those concerns to some degree today. They also expressed concerns about tissue fragility of the genitals. And I did a lot of investigating and could find absolutely nothing in the literature about this concern. And I spoke to colleagues who also really couldn't tell me anything except expert opinion in that area. So I'm sorry that I don't have information about that specific concern today. Psychosocial concerns include relationships. And again, Mackenzie Aberson did a great job this morning talking about navigating relationships and maintaining intimacy. Fatigue is a common complaint, and not having enough energy, feeling exhausted after sex. On Saturday, there's going to be several physiotherapy presentations that talk about building endurance and maintaining, building strength and joint stability. So I'm sure that there's going to be some solutions offered in those presentations as well. And then anxiety about physical injury during intimacy. And Martha Wiggin will be presenting on open communication with partners. And so I think the Society has done a wonderful job with their agenda to try to address all of these concerns. And I think it's important that we acknowledge that these concerns are there. I'm so excited to present some very preliminary data on survey data that was done at the Mayo Clinic EDS clinic in Florida. And this was a survey of, at the time, 86 males seen for suspected EDS and HSD. 90% of them were under the age of 50, and 90% were white. In this, the graph, the table you can see here, about half reported no sexual problems, so that's good news, but half also did report sexual problems or concerns. 22 wanted to feel more interest in sexual activity. 23 had pain during or after sexual activity. 14 had difficulty having orgasm. 14 or 16% felt anxious about sex. 11 felt they didn't even enjoy sexual activity. And 20 or 23% reported difficulty with erections. So this survey is consistent with the EDS Society survey mentioned previously. The Mayo Clinic EDS clinic survey also found that males reported joint issues and pain. Joint issues included joint pain, subluxations, dislocations, and sprains, no surprise. And then which joints have pain? Greater than 50% of the respondents reported pain in multiple joints, as you can see. Neck and shoulders, elbows, wrists, and hands, and fingers, hips, knees, and ankles, feet, toes, spine, jaws, and ribs. They also reported muscle pain, again, not specific to sexual activity. But this data is very important to document the experience, sexual or otherwise, of males with EDS and HSD. And muscular pain was reported in the neck and cervical spine, shoulders, arms, upper back, lower back, hips, buttocks, upper legs, and lower legs. So the Mayo Clinic data is consistent with the EDS survey data and really validates that Males do have joint and muscle concerns, and they also have concerns relating to sexual function. And it's important for us to acknowledge this, validate it, and further study it so that we can help provide solutions. And that's what I hope to talk about next. There is a myth that good sex must be spontaneous and unplanned. Well, unfortunately, with chronic illness, this sometimes just can't be possible. So you can think about other strategies. Plan for sex at a time of day when you generally feel your best. Time your dose of pain relief medications so that its effect will occur during sexual relations instead of later or before. And pace your activities during the day to help avoid fatigue. Further, if endurance, holding positions, and anxiety about sexual activity are a concern, then you can actually plan to warm up for sex. Practice exercises and activities to prepare your mind, emotions, muscles, and joints for the activity and to promote a better sexual experience. For example, use a vibrator or a lubricant before sex to help produce arousal and to facilitate insertion. Take a warm bath or shower before sex. People think of taking a shower after sex. Take a shower before sex. Get warmed up. Take a shower with your partner. Use massage lotion and massage each other prior to sex to get ready. And seek out advice on comfortable sex. This is a picture of a booklet that I've actually referred to for many, many years that's been out there on sex and back pain. And I have used this booklet. There's lots of other resources out there for you to investigate. And really important to talk to your healthcare provider about your specific concerns. And one of the presenters yesterday recommended that when you speak to your healthcare providers that you pick one or two or maybe three big topics. So this might be a topic all in itself to save for a single appointment with your provider, or maybe one of two important topics to talk about because it's a big one. In my 34 years career, I've noticed that females or women in my practice are more used to talking to their doctors about sexual concerns, not so much the males. They don't seem to be as forthcoming or want to give the details. So planning ahead. So Dr. Knight talked yesterday about pre-visit planning, and I'll just review those. Step number 1, remain calm. Step number 2, know your body. Step number 3, bring a list with you, which contains your symptoms, medications and treatments, medical records, and your list of questions. And of course, as we've been talking about for the last several presentations, it's important to find the right doctor to talk to. So here's my warning. I'm going to be showing some explicit images ahead. And so I would rate these as R-rated. And so if there are young people in the audience or children who you don't want to see explicit images, let's take a moment now and give you a chance to leave the room or change the screen if you're at home. Please be aware that this content will show graphic drawings of people having sex. And next, I'm going to review some strategies for adding support and comfort during the physical activity of sex. I'm using terms in the culture and on the internet of different sexual positions, and I didn't make these terms up, but hope to share the wisdom of many who have considered these concerns before me. So when thinking about sex, one place to start is think about the positions that you prefer. This is the classic missionary position. It's a good place to start. One partner's on top and the other partner's on the bottom, and they're facing each other. Consider adding pillows under the bottom partner's buttocks, which supports the bottom partner's lumbar spine or lower back. This also reduces the amount of hip extension in the top partner, which happens during thrusting. Hip extension and lumbar extension occur together, so this may reduce low back pain in either partner. Notice in the picture that the bottom partner's legs are not spread widely apart, which is the classic missionary position. So believe it or not, it is possible to have intercourse without the legs spread widely apart. I have to laugh because I never imagined I would be saying the words doggy style at an international healthcare conference, but this is the modified doggy style position, and a great strategy for improving comfort for both partners is adding pillows or even a therapeutic exercise ball under the abdomen of the bottom partner, which again supports the lumbar spine and hips of both partners. The term cowgirl or cowboy implicates the sexual position is like riding a horse, with the top partner straddling the bottom partner, either forward or reverse. Adding a pillow under the bottom partner's buttocks and legs adds stability, which is a magic word in EDS and HSD. It supports the spine, hips, and knees. And look at the pillows under the knees. Putting a pillow under the shins or even between the top leg's partner's thighs and shin can reduce the amount of knee flexion or bending and reduce strain to the knees. And this can be good for both partners, not just the EDS HSD partner. Spoon position is when both partners are lying on their sides. The partner behind is doing the thrusting, and the partner in front is in the receiving penetration. Notice the pillows between the legs and under the thigh of the front partner. This adds stability and control to both partners. We don't know if both partners are hypermobile, but this can help whichever one is. The pillow under the front partner's arm adds stability to the upper body and shoulder girdle, and this benefits either or both partners. This is a great low physically stressful sexual position option for both partners. And there are surely more sexual positions invented by sexually active humans than the ones I've reviewed here today. The last one I want to show is what I call legs over top position. And this position is probably the lowest physically stressful sexual position that I have evaluated and recommended. Both partners can maintain a relatively neutral spine position, and they don't have to work against gravity. And the male in this picture is lying on his side and does not have to support himself on top or thrust from the bottom. The female in this picture is resting her legs over the male's torso and can move as little or as much as she wants in a relatively supported position. So of all the positions we've reviewed, this is likely the easiest and least physically stressful. It would not require any additional training to prepare. But we've talked about the fact that sex is physical activity. So let's think about how we prepare for physical activities. If you were planning to run a 5K or a marathon, you would be wise to train for it. And you can think of sex in the same way. So in physiotherapy, we call this concept the specificity of exercise. In other words, if you want to be good at running, you train to run. If you want to be good at ice skating, you practice ice skating. So if you want to be good at sex, you can train for sex. And training for sex requires cardiovascular exercise because this promotes blood flow. Blood flow is critical to good sexual function. Cardiovascular exercise increases stamina, and we know adults should have a minimum of 150 minutes a week of moderate to vigorous physical activity. And those are international physical activity guidelines. You can also practice specific exercises to strengthen muscles and protect joints, practice positions used during sex, practice movements used, changing positions, and practice endurance training. Blood flow is critical because the way that an erection works is by blood flow to the penis. So this is a picture of a penis, and the erectile bodies in the penis are made of spongy tissues that have to fill with blood in order for an erection. So the top picture is a flaccid or non-erect penis, and the bottom picture is what happens when males are sexually aroused, and the tissues fill with blood. So for this complex system to work, a man needs a healthy brain and penis, good blood vessels and nerves, and adequate amounts of the male hormone testosterone. If any aspect of this system is affected, erectile dysfunction can occur, and this was a concern expressed by males with HSD. As a pelvic physiotherapist, I use a pelvic anatomic model to explain the anatomy to my patients. So what you're seeing is the model that I use in clinic. From the superior view on the left-hand side, you can see the muscles deep inside the pelvis. Those are the pelvic floor muscles. And on the right-hand side, you can see the superficial genital muscles and the deep pelvic floor muscles. And these muscles contain the urinary sphincters and the anal sphincters, and they support all the organs. These muscles respond to exercise and can be trained just like any other muscle in the body. And this is what pelvic physiotherapists specialize in. So pelvic floor muscle training is training these muscles specifically for endurance. Now, I mentioned that erection is based on blood flow. It's not based on muscle contraction. However, it turns out that training the pelvic floor muscles improves blood flow and thus improves erection. So there are multiple studies, I've only referenced one here, that have shown that training the pelvic floor muscles improves erection. I have listed the exercise prescription on this slide for your future reference. The problem is that many people do not know how to access these pelvic floor muscles because they're invisible. They're deep inside the pelvis, and they may think they're contracting them correctly, but they're actually doing it incorrectly. They're contracting the abdominals and the gluteal muscles instead. And so it may be worth your while to consult with someone like me to determine that you are contracting these muscles correctly. I also want to mention that there are devices that can help to improve erection. This is called the ONUT device. It's a soft silicone ring that goes around the base of the penis, and it constricts the spongy tissue and improves engorgement of blood flow. And it also can reduce the depth of penetration. This can be helpful for a female partner who has difficulty with deep penetration. There are a variety of medical treatments for erectile dysfunction listed here. And one important recommendation is to make sure that you evaluate the medications that you're currently taking for possible negative side effects. There are many medications that negatively affect sexual function, so review those with your doctor or pharmacist. Also know that there are many medications on the market today that can help improve erection. And then plan to manage your joint and muscle pain during sex. I recommend consulting with a physiotherapist and developing a relationship that you can talk about these concerns with your physiotherapist. It's important to perform exercises regularly so that you build up your endurance and your stamina. And as I mentioned, think of performing exercises as a warm-up to sexual activity. Make sure you perform exercises with mindfulness and control. Don't push to end range, and practice holding these positions. I'm just going to show a few exercises that I selected that can be helpful, including the popular child's pose. That's a common yoga pose. Plank exercise to develop stamina on the on top position. Upward facing dog to practice thrusting, and star pose to practice changing positions during sexual activity. And then bridging, common exercise prescribed by physios all over the world to strengthen the glutes and the core, and to help practice with upward thrusting. So be sure to talk about these concerns with your healthcare providers, and remember that health and relationships affect each other. Sex and intimacy are good for you. Cardiovascular fitness is important for good sex because blood flow, baby. I like to say blood flow, baby. Pelvic floor muscle exercises can improve blood flow, baby. And you can train for sex to reduce muscle and joint pain, improve endurance. You can modify positions and use support to reduce strain, and partner with your doctor and physiotherapist for individual recommendations. Thank you so much for your attention and this great opportunity.